Hello, my name is Murji, and I'm Associate Professor of Obstetrics and Gynecology at University of Toronto and Minimally Invasive Gynecologic Surgeon at Mount Sinai Hospital. I hope to talk to you about the fact that you have been diagnosed with iron deficiency or iron deficiency anemia. Iron is extremely important in making red blood cells, which is the primary component of blood, and this transports oxygen all over the body. Now, if you're low in iron, you may experience a variety of symptoms, and these may include headaches, tiredness or fatigue, poor concentration, shortness of breath with minimal exercise. Some of my patients experience low mood or even complain of restless legs, especially at night. And others may even comment that you look pale. So the big question is, how do you treat iron deficiency? Now, before we get into all of the different formulations of iron, I want to emphasize that the number one way to increase your iron is to stop the bleeding. I equate it to a bathtub. If you want to fill a tub of water, or let's say in this case iron, it becomes extremely difficult if the drain is open. If every month you're having a heavy period, it doesn't matter how much iron you take or how you take it, it's really hard to get that iron up. You must stop your period or make it lighter so you're not losing iron every month. If you want to fill your iron bathtub, make sure that the drain is closed. Now, when I tell my patients that they're iron deficient, the most common response that I get is, "It's okay, doctor. I'll just change my diet and I'll eat more steaks and have more leafy vegetables." Now, it's great to have a healthy diet, but if I can emphasize one thing, dietary iron is great for prevention, but it is not enough for the treatment of iron deficiency. The reason is that only a fraction of the dietary iron, the iron that you eat, is absorbed. So if you have a 6-ounce steak, only 1 to 2 milligrams of iron is absorbed by the gut. The bottom line is that if you're diagnosed with iron deficiency, you need to take iron supplementation. Increasing iron in your diet is great, but it is not enough. The mainstay of iron deficiency treatment is oral iron supplementation. Now, there are a few circumstances where oral iron is not ideal, and these are patients who can't absorb iron through their gut. Examples can be if you've had a bariatric surgery or gastric bypass, or if you have inflammatory bowel syndrome, such as Crohn's disease, or in some patients, if they have inflammatory conditions or rheumatological conditions, they are not able to absorb iron through oral iron. But for most others, oral iron supplementation is the first-line treatment of iron deficiency. Now, if you go to the pharmacy, there are a ton of different options. There are pills, there are capsules, there are drops, there's extended release. And it can get really confusing about which one should you choose. So my advice is go simple and go cheap. 2 iron salts are perhaps the most effective treatment for iron deficiency, and they're the cheapest. First is ferrous gluconate. Brand names include Floradix, for example. The other is ferrous fumarate, and brand name for that is Palafer. And here's an example of the brand name for ferrous fumarate. The dosing for these iron supplements can be found in the accompanying handouts to this video. So how should you take these oral iron supplements? I suggest start taking it daily. Take it on an empty stomach, and take the iron tablet with a vitamin C supplement or citrus drink. I usually say take it before bed, and that's the best, because we know that taking it with coffee or tea decreases absorption, and most of us are caffeinating early in the morning. Drink it with lots of water. And there's certain things that you should actually avoid when you're taking your oral iron. Mainly if you're on thyroid medication or antacids such as Tums or Pepcid, or one of the prescription antacids, you should avoid taking those along with your oral iron. Now, the biggest issue with oral iron is that it can be hard on your stomach. It can cause dark stools or stomach discomfort. Some patients experience nausea or even diarrhea or constipation. But these side effects can be bothersome, but they are not dangerous. So how can you prevent some of these side effects? First of all, drinking lots of water is helpful. Increase fiber in your diet, for example, bran or vegetables or Metamucil. I tell my patients to take a stool softener, even prophylactically, just in case. And for example, Senokot or PEG are great stool softener. Now, if these side effects still persist, I tell my patients that instead of taking the medication daily, take it every other day. And we have some studies that show that it can be effective, just as effective, if you're taking the medication every other day. After starting oral iron, it is important that about a month after, you should get your iron levels tested again to make sure that the treatment is actually working. So you should talk to your doctor about this, because there's no point taking the medication and if your iron levels aren't going up. The other thing is that if you're not tolerating the iron, or if you're not absorbing it, it might be necessary to change to another form of iron, for example, intravenous iron.